Welcome to episode 26 of the Two Docs Talk podcast. I'm your host, Rob Hoyer, joined by my colleague, Abbas Shafi. Today we have a very special guest, Dr. Nan, who's a traditional Chinese medicine physician. And Dr. Nan has kindly agreed to come onto the show to give us an overview of traditional Chinese medicine. I'll read from Dr. Nan's bio. So Dr. Nan is a distinguished physician in acupuncture and Chinese medicine. He's board certified in both the U.S. and China. He holds a doctorate from the Zhizhong University of Chinese Medicine, specializing in Chinese medicine and acupuncture. He's a third-generation legacy physician who's part of 7 practicing Chinese medical doctors across China and the U.S. He has 35 years of pedagogical experience, and he's taught thousands of acupuncturists in both the U.S. and China. In 1992, he became a faculty member at Colorado Chinese Medicine University. And in 1993, Dr. Nan established Nan's Acupuncture Clinic in Denver, Colorado. He practiced for over 35 years in the U.S. and in China. He's been involved with clinical research, with pain management, with the Kaiser Permanente Group and St. Joseph's Hospital in Denver between 1993 and 1996. And was recognized by the Denver Broncos, who appointed them as their official acupuncturist from 1995 to 2014. We cover a lot of content with Dr. Nan, including an overview of traditional Chinese medicine, different conditions that can be treated, methods of treatment. We talk quite a bit about integration with Western medicine, and also about how to select a Chinese traditional medicine physician. We're so happy that Dr. Nan came onto the podcast and that we're able to bring you this interview. As always, if you have any questions, please feel free to reach out at rob@twodoctalkpodcast.com. And if you like the videos and podcasts, please subscribe and like. That helps others find the podcast in the search algorithms. Without further ado, we bring you Dr. Nan. Dr. Nan, good morning. Wow, it's great to see you again. And it's been a while since I've seen you in person, but you've not aged a day. You look great, and it's great to see you. And thank you for doing this.
Well, thank you, Dr. Hoyer. So you're doing great. You look great too. I haven't seen you guys for how long? Probably 7-8 years at least.
It's been at least 7-8 years. Yeah.
Yeah, you look great. So thank you for doing this. I'm excited.
Well, one of the concepts from our podcast is this integration of different concepts. And, one of the things that we've talked about a lot is having different approaches to health and how to really promote wellness. And so that's something that when Abbas and I were thinking about how can we really introduce some new concepts, we thought about traditional Chinese medicine. And I said, I know who we're gonna call. So, maybe, Dr. Nan, if you could give a little bit of background about, how you got into traditional Chinese medicine and a little bit of the concepts. I think a lot of us know about the yin and yang, but don't really know what exactly that is. This concept of qi. Maybe you can give us a few minutes, kind of a summary of that.
Sure. Yeah. I got into this Chinese medicine. One of the actually main reasons, this Chinese medicine runs in my family. I'm a third-generation physician of Chinese medicine. When I graduated from high school, which is in 1976, because of the Cultural Revolution, I don't know if you guys know about anything about this. The Chinese government basically shut down the whole education system. So they sent teachers, professors to the countryside to do so-called re-education. Obviously, the schools are closed because nobody's teaching there. So just like everybody else, I didn't have a chance to go to college, but I was lucky enough to start learning Chinese medicine from my uncle and my aunt. They both are Chinese medical doctors and been teaching and practicing in their whole life. They're still, by the way, they're in the 80s, they're still seeing patients today. So that's how I got into this. I studied with my uncle for about 3.5 years, and then I started seeing patients because I was born and raised in the countryside. I started seeing patients as a barefoot doctor. That's the name we got. So finally, in 1983, I went to medical school after they resumed education system. That they did that in late 70s. So finally, I went to a Chinese medical school and got my education. So after I graduated from medical school, which is called Heilongjiang University of Chinese Medicine, located in Harbin, China. So after graduation, I taught at university and practiced at the teaching hospital until I came to the US to teach. Because of the school in Denver, Colorado, they just changed the name to Colorado Chinese Medicine University. The owner and is one of my students. He went to our university in China in the 80s to learn Chinese medicine. That's how we met. So after he started school, and he sent me a letter. He said, I need a teacher. So that's how I came here. And I'm so happy to be here. So I've been here since 1992. And I started my practice next year, 1993, in Denver, Colorado. Also worked with Broncos for 19 years. And I moved to Sarasota. That's where I am now at the end of 2019. So I'm still teaching at the Colorado School of Traditional Chinese Medicine. That's the old name, Colorado Chinese Medicine University. I'm still one of the faculties today.
Well, that's wonderful. Thank you for that background. And wow, it's I always find it amazing to hear folks, our guest stories, and just to learn about where it started, how you started with this, and where you are today. That's really amazing. Maybe you could talk a little bit about some of the concepts of traditional Chinese medicine and how that this whole yin and yang and the concept of qi and how that works. So just an introduction so our listeners can just have a kind of just some of the basic concepts that we'll be talking about today.
Of course. So Chinese medicine, actually, I don't know if you knew this, is not discovered by Chinese medical doctors. It's discovered by ancient Chinese astronomers. By observing how the moon, the sun, and all the stars move, they discovered that the energies out there in the universe. So they call that energy, eventually they call that energy qi. They give a Chinese name called qi. And also, human bodies, we're a part of the whole universe, and we have the same energy, the same qi that flows in our system. And that, of course, it took so long for them discovered there's certain energy meridians. There's actually 14 of them, okay? There's 12 of them we call formal meridians, which is qi flows along. And also there's another two. One is called rim meridian, one du meridian is the front and back. So the qi flows to the meridians. The purpose of that is that for the body to heal. The body heals through the qi flow. So if the qi flows properly along the meridians, and the body heals properly, and the body functions properly, and then you're a healthy person, right? If the qi doesn't flow well anywhere in the body, we call blockage of qi flow. That's when the problem starts. Because once the qi got blocked, and that part of the body will stop healing, eventually will cause damaged tissues. The cells become dead and cause damaged tissues. So more damaged tissues build up, the more function more function loss we're going to have. Okay, we'll have a certain amount of function loss. That again, that could happen to any part of the body. Okay, and then that's when you get to that point, the body will start losing function. We'll have a more function loss we have, the more symptom we'll have, because when we reach a certain point, we'll have a certain amount of function loss. That's when the body will say, that's enough. I'm going to start warning with so-called symptoms, which can be anything, depending on where the function loss is. the function loss could happen to any major organs, okay, like heart, liver, brain, and it could happen to any part of tissue, like the joints or soft tissues. Depending on where the function is, the function loss is, will have certain symptoms. So the symptoms in Chinese medicine are they're not problems. Okay, we'll never go after symptoms because they're warnings. Those are ways your body try to warn you, try to tell you somewhere in the body there's a function loss. All your body is asking for, find it and fix it. Okay, let me give you a analogy here. Symptoms, doesn't matter what that is. They are just like the check engine light in the car. They're nothing more than that. Okay, I'm pretty sure you've seen that in your life. If the check engine light lights up in the car, you know what that means. And also you know what to do with it. Basically, you're going to take your car to the mechanic, have the car checked, the problem found, and fixed. Guess what will happen to the light? It goes away. That's exactly how Chinese medicine works. And also in Chinese medicine, we don't have a name of disease. The reason is the purpose of Chinese medicine is to treat disease before its onset. So that's why we have to always listen to the body, because your body always warns you. Okay, the body doesn't lie to you. If there's one symptom, there must be at least one thing wrong going on somewhere in the body. Okay, in general, we don't go after symptom because we don't cover up the symptom. Because you think about this, if the check engine light lights up in the car, and you think the light itself is a problem, and you put a Band-Aid over it, or you cut the wire, and you don't see the light, you think that you can keep driving the car. What's going to happen to that car? Because the problem's still there. And if you don't see the light, the problem keep getting worse until one day the car breaks down. So now they come to, the difference between Chinese medicine and Western medicine. So once the car breaks down, that's when the patients need to go to see you guys. Because Western medicine, as you know, is disease-based medicine, right? That's when you guys do a great job. And you can treat disease and then try to save people's life. So one of your questions you asked earlier, how to combine these two medicines. In my opinion, we start, anything happens, we start with Chinese medicine first, because we treat root cause. Most of the time, we can stop it right there. So restore your health. But in case of when the problem too far gone, become disease, that's definitely you need to see your doctors, like see any specialist to have you treat disease, have the problem fixed, and to save your life. In my opinion, that's how we should combine these two medicines, and that works really well. It's been working really well in China. In China, half the hospitals, or let's say half the Western medical hospitals, there's a Chinese medical doctors work there, okay, to see patients. They have the Chinese medical departments. And in Chinese medical hospitals, so there are Western medical departments, there are Western medical doctors. So that being really the best for the patients. I hope one day that's going to start happening here in this country, and patient will benefit from that. Hopefully, to answer your question.
That is great. Thank you. Abbas, would you like to answer that? Ask the next question.
When you see a patient, when you think that you refer to modern medicine, what are some of the condition, that you think that's, first, how do you, when the patient come to you, how do you treat, preventive medicine or the symptoms that alarming, and then when you think that they should see, surgeon or physician, this country is very, very difficult because everything is disease, management. So if you have a gallbladder, they take it out. If you have, broken bone, they fix it. And there's nothing looking for, as you said, one preventive. And then after that, what to do the next? Because as you know, one organ when it hurts, the other organ hurts. So there's nothing, just one focus problem, and a lot of us subspecialty in one things. So it'd be good to sort of to see how to prevent and how you do that and how when you refer to the doctors.
Okay, that's really a good question. That's something I have to deal with every single day when I'm seeing patients. So again, in Chinese medicine, if you have one symptom, there must be at least one thing wrong going on somewhere in the body. Okay, that's our job. That's how we're trained to detect where the cause is. So the way we do it, basically, the number one thing we take your pulse. Okay, the pulse can indicate this indicators what organs you have problem with. We have a pulse in 6 positions. In Western medicine, when you guys take pulse, basically, first of all, you want to detect if there's a pulse or not, right? If there's a pulse, you see how fast that is, and it's 2 weak or 2 strong. You don't care about 2 strong part, but if it's 2 weak, that's basically the information you try to get. So when it comes to Chinese medicine, it's totally different because the 6 positions, each positions represent each organ. And there's different characters of pulse tells you different problems. That there's yin deficiency or yang deficiency, the excess yin or excess yang. Also, probably you heard of it, the 5 elements. Okay, for example, the heart is fire, the liver is wood, and the lungs is metal, and the kidney is water, and spleen is earth. And also, they're all related. You said earlier, one organ has problem could affect others. That's so true because if you have weak wood, that could affect the fire. Also could affect the earth. That means when you have heart disease, that could affect your liver and could have your spleen. And also it could affect the rest of them, the kidneys or lungs. So in Chinese medicine, we have, first of all, we find where the major problem is. We target that part. Once that's balanced out, and we find the next one. We go by layers. Once they're the five elements in that certain pattern, they're balanced. That means your body's functions is fully restored. Guess what? You're a healthy person again. So in Chinese medicine, of course, I'm not saying Chinese medicine cure everything. When is problem too far gone, in general, by Western medicine, medical standard, you become diseased. And that's when you need to see a Western doctor like you guys. Okay, you guys do wonders on that part. Even that, once the patient's condition is stabilized, I will still recommend go to see a Chinese medical doctor to work on the cause, the root cause. And even though you have the problem completely cured, like Dr. Hoyer, you treat cancer patients. After the cancer patients stabilized, I would recommend to do something to maintain that function, to maintain the health. That's when Chinese medicine, comes into place. Does it make sense? That's how we do it. Again, when even the cancer's gone, that doesn't mean the cancer will stay away from forever. In Chinese medicine, we always want to treat the weak organs, make sure the qi flow is balanced in your whole system, and then you have the strongest immune system. That's how Chinese medicine helps with cancer patients too. Did that answer your question, Doctor?
Yes, indeed.
Okay.
Yes, indeed. That's terrific. That's great, and that's the balance that I'm hoping is one day we achieve in this country, to not be a sort of disease management, be able to accept there's alternative. And then I see that all the time. I see many people, as the same thing you say, they have heartburn. And the heartburn is the son. I tell them you need to look what you're eating, what other things. And it is alarming. The majority of the people, these people, they have heart disease, but if we ignore the symptoms, other disease will fail. And once one fails, the other thing does. So that's terrific way to do. And I think to having that balanced things, looking for longevity and as well as solving the problem. I think it's great. Another question I had, what about the tongue or facial expression or other things that in Chinese medicine? What was that? I know beside the pulse, other sign you guys look for. What is that? Can you explain some of those?
Yes, I'm glad you mentioned that. Uh, Observation is one of the four major tools we use to make diagnosis. By observing, how the patient looks like in a whole system, especially the complexion, because in Chinese medicine, the complexion is the reflection of a function of the major organs. Okay, so like different part of your face that indicates different relates to different organs and different color of the complexion that tells you different organ. For example, like when it comes to liver relates to the color green, right? And liver and gallbladder, they're kind of cousins. Liver is yin organ, gallbladder yang organ. There's always in pairs, okay? Like a spleen and stomach, kidney and urinary bladder, and heart and small intestine, lungs and large intestine. So again, the green color is the facial complexion that tells you how well your liver and the gallbladder function. And if your complexion is dark, it's black, we call black color, that indicates you have a malfunction either in your kidneys or your urinary bladders. And if your face is unusual red, okay, that tells you have a heart issue, or unusual pale, you have heart issue. And again, we do, the first thing we're going to watch is how the patient look like when they walk into my clinic. That's a really good question. So that is one of the tools we use for diagnosis.
And Dr. Nan, could you talk a little bit about the methods you use? And you talked about a little about the diagnostics you just mentioned with the facial color and other observations, which I find fascinating. Can you talk a little bit about some of the conditions that you or excuse me, about some of the methods that you use. So specifically whether it's acupuncture or different medicinal herbs. I know there's a variety of different types of treatments that you offer.
Okay. So in Chinese medicine, mainly there are two major parts. One is acupuncture, one Chinese herbs, and that's what most practitioners, doctors use. And for acupuncture part, we have several different techniques. The main one is called TCM, which is traditional Chinese medicine acupuncture. And the second is CCM, which is classic Chinese medical acupuncture. And the third part is very common techniques called neuroacupuncture or scalp acupuncture. That's basically scalp acupuncture is more Western medicine part, because that's based on central neurological system, a certain part of the brain, which part of the brain we need to work on depending on the symptoms. So those are three major parts. Also, there's some other techniques like, balance method and meridian targeted acupuncture. Then also there's a pigeon. We have many different modalities, but there's three major techniques: is TCM, CCM, and neuroacupuncture. And on top of that, of course, we use Chinese herbs. The main purpose of that is they work the same way, by the way, but not everybody's going to have acupuncture every day, right? So herbs, they can take it home, that it helps in between acupuncture treatments that can speed up the healing process. That's basically what we do. So when you talk about what the conditions, there's so many conditions we can work on. Let me just give you an example here. Years ago, when I first came to this country, I was treating a couple who was an MDs, and I started with a daughter first with autism. And then I helped the daughter so much, and they decide to become patients. I treat them, and then they send their colleague. I will never forget this. This. They sent a colleague who is a neurologist, an old gentleman who had this migraine headaches for years. He just couldn't completely get rid of it, and all he could do is take painkillers to manage it. I remember when he came in my office for the first time, we started talking. I could sense it on his mind. He said, "There's no way you could help me." Okay, but he didn't say it. I could sense it. And then at the time, he was having a headache, and I asked him, do you have migraine headaches right now? He said, yes, right here in my right temple. I said, okay, are you ready for the treatment? He said, yes. And then he thought, I'm going to poke his temple. That's what, by the way, that's the most acupuncture will do. I didn't. Instead, I give acupuncture on his left hand. I said, before I did that, I said, how much pain do you have on a scale from 1 to 10, with 10 being the word? He said, 6 or 7. I said, okay, you're really in pain. I said, are you ready for the relief? He didn't believe me. And then I gave him 3 needles on his left hand. I said, tell me how much better you feel. He started trying to feel it so hard. He started doing, even moving his head. He said, I have to say, I don't feel the pain. I said, okay, do you think the acupuncture treatment helped? He said, I have to say so. I said, okay, that's great. I said, could you explain to me how the connections made between your left hand, your right temple, by what you do, neurology? He said, be honest, I have no idea how that connection made. I said, that's so true, because the meridian system is totally different. It's a separate system, totally different system from neurological system. We're working on totally different thing. You working on that physical part of the body. I'm working on the energy part of the body. If I have to give you an analogy, that's like what you do is working on the landline phones. What we do is work on wireless phones. And he's laughing. He said, that really sounds right. I said, that's how acupuncture works. So another one is recent. I'll give you another example. A friend of mine, when I first moved to Florida, we built a house in it's a community far from us, actually. I met a gentleman who's Chinese, and I became friends. He had this dizziness for years. Never became too bad until this, like sometime last year. And really bad, he couldn't get out of the bed. And he didn't call me. So finally, one day he called. He said couldn't stand it anymore. He's just dizzy all the time. And also, he saw his doctor. The doctor diagnosed him with Meniere's disease. And he was taking was on is basically water pills. And then it did help some in certain level with dizziness, but he still had to be in bed. So he called me and said, okay, let me go to your house and give you treatment. I treated him 2 times and he got out of the bed. And he would start walking with a walker. And I give him one more treatment. 3rd treatments later, he threw away the walker. And the 4th treatment, he drove 50 minutes to my office. And that time, he and his wife scheduled for a 3-month-long trip to visit Southeast China and Asia. And they were thinking about canceling that trip. So as we're doing the treatment, he's getting better and better. Finally, not only he didn't cancel the trip, he went on that trip with his wife for 3 months. Luckily, he didn't have any dizziness on the trip. And the 2nd day, believe it or not, after he returned, he started feeling dizzy, but nothing like it before. So he called me right away. He started treatment right away. Till this moment, he hasn't had any dizziness at all. So that tells you, when you work on the physical part, or you can see, or probably you cannot see the physical cause, with Western medicine, but energy-wise, we can always detect if there's an energy blockage or one organ is damaged to cause that symptom of dizziness. So in Chinese medicine, dizziness basically that releases two organs. If could be related to organs. One is kidneys, one is liver. So when I talk about the kidneys or liver, I'm not talking about the liver disease or kidney disease. I'm talking about the function loss in the certain organs. It's not disease. So this particular patient have enough loss in his kidneys. That's why he had such a bad case of dizziness. So basically, obviously, I worked on his ears, but mainly I focused on his kidneys. And he also had this frequent urination for years, and then that symptom got better too. So again, to answer the first question you guys had, how to combine these two medicines, I think that's crucial to healthcare. If really, Western and Eastern work together, I think the patients are going to benefit so much. And not only we can improve people's life quality, and we can help people live longer. So I really hope one day we're going to start doing that.
I agree.
That's medicine too. One thing I was going to ask, beside the acupuncture and herbal medicine, what about the diet? What are the recommendation of the traditional medicine and balancing the diet?
That's another great question. Okay, first of all, Chinese medicine figured out what could cause the qi flow problem. Okay, basically there are three major types of the causes. And believe it or not, the number one cause is emotional cause, which is stress. Okay, and Chinese medicine has been dealing with this cause for thousands of years. In my opinion, there's over 90% of a health problem caused by stress. So what stress does to the body is stress messes up qi flow, okay? Make qi flow blocked somewhere in the body, and that'll cause tissue damage, cause function loss. So the second cause is the chemical cause. So this cause will answer your question. So the chemical cause includes two parts. One is toxins, okay? The toxins for the pollution in the water, food, air, and some of the medications. All those can mess up qi flow. So the other cause is lack of nutrients, malnutrition, okay? And that can cause qi flow problem too. So the third is physical cause, trauma, injuries, surgery, they all mess up qi flow. So to answer your question, your question relates to the chemical cause. So again, if we have too much toxins in the system, and certain part of the body, the qi flow will decrease, and to a certain level, again, that part of the body will stop heating. This heating process will stop. It will cause dead tissue, dead cells, dead tissues, damaged tissues, and then we'll start function loss, right? We'll start having function loss. When the function loss gets a certain level, the body will start warning you, right? You're going to have symptoms. And then if you don't take care of it, one day, the symptom, the cause, malfunction get back to the certain level. And by Western medical standard, you have certain diseases. So the way Chinese medicine treats the problem, like I said earlier, we don't go after symptoms. We have to find why you're having the symptom you're having. Then we'll work on the cause. We have to figure out where the blockage is. Really, it doesn't matter. The cause is emotional or chemical or physical. We have to find where the blockage is. So when you talk about the diet, yes, in general, the general diet, the health diet, I think that should be good enough. One thing I want to want to emphasize is sugar. Stay away from sugar. We don't need to add any sugar to our diet at all, zero, because sugar to human bodies toxins. That's the number one cause of not chemically, the number one cause of a qi flow problem. And the rest of them, of course, if you're on in general, pretty healthy diet, you should be good because we need balanced nutrients. I don't like the strict diet. You complete stay away from meat, complete stay away from a certain food. I don't do that. My opinion is we need to have a balanced nutrients. That's why I eat multiple vegetables, fruits, and meat. I do eat meat. I eat a lot of fish. I eat beef once in a while, pork once in a while in my diet. I've been feeling good, Also, I believe everybody can change their health conditions. Unfortunately, I have to say, in this country, most people are not healthy, are not feeling the way they're supposed to feel, right? In other words, everybody almost can feel better because if the qi flows better, your body functions better, automatically you feel better, okay? A healthy person, like I said earlier, you're supposed to feel energized. You're supposed to feel happy. You're supposed to sleep well, meaning wake up in the morning, you feel energized, you feel happy, you want to get up doing stuff, enjoying your life. Sleeping well doesn't mean, it's actually the key to sleep is not about how long you can stay in sleep. Okay, everybody requires a different amount of sleep. There are people who require 5 hours. There are people who require 10 hours. But the key to sleep is you want to wake up feeling refreshed. That's how you're supposed to feel in the morning. Because the reason for that is your body heals only during sleep. If your body heals well, it doesn't matter if it's in 5 hours or 10 hours, then you feel well in the morning. So again, remember, you want to feel well when you wake up in the morning.
I just can't help asking, what do you think about cell phones? Are those a toxin?
See, I'm wearing this. Yeah, like what yours is wired
it's a wire. Yeah,
is wired. Okay, that's good. I always wear wired earphones. Doesn't matter headphones or earphones. Cell phones and wires, earphones and headphones, they all have radiation. And I cannot give you the proof, but if you think logically, especially by Chinese medicine, that interferes the qi flow, okay? And physically, the radiation will affect your body physically. That could damage whatever, especially close to the earphones or close to the phones you have. So I don't recommend you put your phone so close to your body for a long time. Obviously, today we cannot live without cell phones. But what I do, if I don't use cell phones, so I try to put it away from me. Only when I use it, when I have no choice, that's when I have my phone on with me. But what I can do, I can stay away from it. Wireless earphones or headphones, at least we'll get less radiation. So that's my opinion on this.
Thank you. Abbas, you have any other questions for Dr. Nan?
This is a great conversation. I travel through the world and I see a sort of both sides, and it's very tough to sell in this country, but I'm hoping just we get away from the problem in this country is the disease management, of course, the pharmaceutical and the industrial food. So they keep feeding those things. So breaking through those and let people live a better life with less toxins in their body, less that. That's sort of, I'm a gastroenterologist, so I'm trying to accomplish that, but it's a big task. But I think by educating people, I think little by little, I think hopefully sort of opening the people's, some of the prejudices toward the non-Western medicine is quite a bit. I'm from Iran, and we had similar parallel type of traditional medicine to Chinese. I don't know if you know Avicenna and all of that, and humoral in the food and all of that. My grandmother was probably my best teacher, the same as your family. So what you eating, how you feeling, how you sleeping, all of these things. So no, this was great, and I'm so excited that you were here, and hopefully we can have more visits and talk more about it. Would you like to add any more comments? We have plenty of time, so if you
I'd like to ask Dr. Nan one more question if I could.
Yes.
Oh, definitely.
Any advice on identifying a TCM practitioner? There's a lot of folks out there who do acupuncture, but I'm not quite sure if it's really they're certified, or how can we know that when seeing a practitioner that this person knows what they're doing and how to do the certain methods?
Okay, I've been teaching for 35 years. I taught in China for 4 years before I came here to teach. You have to look at, when you're looking for a qualified practitioner, the first thing I would look at is their education. They have to go through formal education. That's very important, because Chinese medicine is such a complicated system, and there's no way you can learn it in a couple of weekends courses. I don't care how smart you are. It took me so many years. I got my doctorate degree, but it took me years to get there. Really, again, it doesn't matter how smart you are. If you didn't spend that much time, there's no way you can really learn this medicine. Even for me, I cannot say I learned Chinese medicine. I'm still learning every day. I'm still learning more, more technique. And especially when it's, clinical, in my clinic, when I see patients, I always have challenge. I always see challenges. That's what, like you and I, all of us, we do the same thing. That's why we'll keep learning. So again, the first thing I look into it, how much education that practitioner have. That's very important. And if somebody, for example, there's some chiropractors that practice acupuncture and then take probably a couple of weekend courses. Legally, they can do it, but I cannot see how much they can do it. Okay. Education is very important. The second, obviously, it takes experience. More experienced, better it's going to be. But I've been teaching so many students here. I've taught a lot of students here, and there are a lot of students very compassionate about it. Even though they only practice like 3 or 5 years, a lot of them are really good at it. Just like any other profession, if you're not compassionate about it, doesn't matter how long you do this, you just do this as a job, it really doesn't help. So it's hard to give you really detailed guidelines how to find a good one. Only thing I have to say is education is number one, but really you need to have to try it. Well, to know if that's the right person to treat your condition. So before we hang up, can I forgot something to talk about here. I'm going to talk about the side effect medications, because the doctors in general, they don't have time to explain to their patient what side effects are all about. Remember, there are 3 causes of a qi flow problem in Chinese medicine. One of them is chemical cause. That's exactly why. Because when the patients say they have one symptom, okay, they go to see their doctor, for example, they have a pain. In general, what the doctor is going to do, they're going to give them painkillers, right, to ease up that pain. If you have a sleeping problem, what the doctor is going to do in general, give you sleeping pills, try to make your sleep get better. So all those chemicals you put in your system, those are toxins in general that doesn't belong to your system. And that further could cause more qi flow problem in different part of the body. Okay. And then you start getting more damaged tissues, and you start having more symptoms, function loss. Again, when you have certain amount of function loss, your body is going to warn you again with a different symptom. Okay, who knows what that symptom is, depending on where that damage is. And that symptom is called side effects, which is actually another health problem. So with a new one, you go to see another doctor. What the doctor going to do in general? Give you another medication to treat that symptom you have. So that's called the side effects. Side effects are actually just another health problem. And that's why in this country, people just keep adding more and more on the drugs, the list of the drugs they're taking. And it doesn't have to be that way. We can actually, there's a way to stop it. There's a way to help people to get off the medication they've been taking, even if they've been taking for years. That's what happens in my practice every single day. And that's why I love what I do so much. You know, I'm supposed to be retired, but retirement has really never been on my brain, on my mind for a second. As long as I stay alive, I want to see patients. That makes me happy. By the way, being happy, that's all, you know, it's all about, the life is all about. And, you know, when I see patient walking with a problem they have, like pain, they have a depression, when they walk out of my office, they feel so much better. That's the joy you don't get from anything else. That's why I love what I do. You know, I don't plan to retire. I just enjoy Chinese medicine so much. So thank you guys to give me this opportunity to explain to people how acupuncture and Chinese medicine work and how much they could help them. If you have any health problem, if you have been taking the same medicine over and over for a long time, I can tell you it's time for you to try something different. If you keep doing the same thing over and over, and you're going to get the same result. If you never get into Chinese medicine, you never learn enough, you never believe that could help you, just give a try. Chinese medicine works in most cases. Chinese medicine works easily, especially for pain. If you walk in the office of a practitioner for pain, I can guarantee you, if that doctor does right, that pain should be gone instantly. I mean, as soon as you put needles in there, the pain will stop. That's how quickly it's supposed to work. And that's at least 99% of the time, that's what kind of result you're going to get. Just give it a try, and it's going to change your life.
Well, Dr. Nan, can you give a handoff to our listeners who may want to come and see you in your office?
Oh, yes. You can contact me. My phone number is 941-888-9888. And my email website is acupuncturehealingworks.com. If you Google me, you see there's a logo on the screen, Acupuncture Healing Works. You can find my practice.
Wonderful. And
do you practice in Florida only or in Colorado as well?
I'm sorry?
Do you practice still in Colorado or only in Florida?
I don't practice in Colorado anymore. I give my practice to my nephew. The office in Colorado is 303-721-6123. And there's another Dr. Nan, Simon Nan. So you can, if you live in Colorado, Denver area, you can find him there. Well, so cool. I just started my practice here in July this year. So I'm new here. And it's been a lot of fun.
Well, certainly your energy comes across even virtually on this webcast. So thank you again, and we're gonna spread the word. We're gonna get this out onto multiple media outlets and get the word out about traditional Chinese medicine and lifestyle medicine. And thank you so much.
Thank you for having me, and let's do that again in the future.
We'd love to. Thank you.
That's so much fun. So good to see you, Rob. So again, you guys ever have a chance to come here to Sarasota, give me a holler. I'll show you around here, okay?
Definitely. All
All
right. You
right.
take care.
Thank
All
you
right.
You take
again.
care.
Take care.
Okay.
Bye-bye. Bye-bye.
Happy New Year.
Happy New
Happy
Year.
New Year to you. Thank you for watching. Please be sure to check out our other videos and podcasts about lifestyle medicine, disease prevention, and longevity. Two Docs Talk, better living for a better life.